Hello everyone, welcome to Miss Doc T. This is Dr. Farheen, General Medicine resident, and today let's discuss approach to a case of edema. So we'll start by looking at distribution of the body fluid water. The total body water is divided into an intracellular compartment which is inside the cells, which is 2/3 of the total body water, and an extracellular part which is 1/3 of the total body water. Extracellular part again has vascular compartment and interstitial compartment. So this vascular compartment is 1/4 of the extracellular fluid, and remaining 3/4 of the extracellular fluid is the interstitial compartment. So this is the same in the form of a pie chart. An increase in the interstitial fluid compartment is called edema. Now we'll understand some pressures before looking at edema. So first is the hydrostatic pressure. So this is the pressure which is exerted by the fluid over the wall of the vessel, and it tends to push the fluid out. So remember, hydrostatic pressure is a pushing force. The second is the oncotic pressure. This is because of proteins. Now suppose we take plasma, it is because of plasma proteins, especially albumin. And this pressure will try to retain the fluid inside. So remember that oncotic pressure is a pulling force. Let's suppose these are the cells. This is a blood vessel and this is a lymphatic vessel, and the blue color, this is the interstitial fluid between the cells. Now the lymphatic drains the interstitial fluid. Edema is increased amount of this interstitial fluid compartment. Now what are the factors that can cause edema? First thing is, when the hydrostatic pressure in the capillary or in the vessel is increased, it will push the fluid out from the vessel into the interstitial compartment, thereby causing edema. Second, when the plasma proteins are less in number, albumin is less, the retention capacity is lost, because of which decreased retention in the vessel will increase the interstitial fluid compartment. Because the pulling force is less, the capillaries cannot retain the fluid. Next, direct capillary leak. If it is present, the fluid will move out of the vascular compartment into the interstitial compartment. Fourth is when there is lymphatic obstruction, because lymphatics actually drain the interstitial fluid. So when there is obstruction in the drainage, there is increased amount of interstitial fluid compartment. So these four factors will increase the fluid in the interstitial compartment, leading to edema. So these are the factors contributing to the pathogenesis of edema. Now we'll look at approach to edema. So edema is divided into two. First is localized edema, which involves just a particular part of a body, or generalized edema if it involves the whole of the body. And this generalized edema is also known as anasarca. Now coming to localized edema. So localized edema is broadly caused because of venous obstruction or lymphatic obstruction, or when there is unilateral paralysis. Now let's look at venous obstruction. So let's suppose that the left leg is normal and the right leg has some obstruction in the venous drainage. So when there is an obstruction in the venous drainage, the blood will start pooling up in the opposite direction. So in the vein, the blood starts pooling up, and this pooled up blood will exert more pressure over the vessel wall. So this is the vein, and there is more pooled up blood downward that will exert more hydrostatic pressure over the wall, thereby the fluid will leak out, causing edema. Causes include thrombus, which may be because of deep vein thrombosis or thrombophlebitis, or because of valve dysfunction that is seen in varicose veins. This will also cause pooling up of blood, thereby increased hydrostatic pressure. Next is lymphatic obstruction, especially because of filariasis, because the interstitial fluid is drained by the lymphatics. So whenever there is obstruction to the lymphatic drainage, the interstitial fluid will increase in amount, thereby leading to edema. So causes include filariasis and chronic lymphangitis. Next is unilateral paralysis. Here, both the venous drainage as well as the lymphatic drainage will be decreased, because of which there will be localized edema. Now we'll look at the causes of generalized edema. So first is when there is heart failure. Suppose there is a failing heart, it cannot pump blood properly, so there is decreased cardiac output. That means the circulating volume is less and the arterial pressure is less. So these two are the factors which can stimulate the renin, angiotensin and aldosterone system. Now once this RAS mechanism is stimulated, it will cause retention of fluid. Thereby this fluid retention will cause edema. This is how heart failure causes generalized edema. Next, second cause is when there is chronic liver disease. Normally, liver synthesizes the albumin, but when there is a chronic liver disease, there is decreased synthesis of albumin, and albumin maintains the oncotic pressure. So, decreased albumin will decrease the oncotic pressure in the blood vessels. Then, the retention capacity is also decreased. Automatically, the fluid will leak out, thereby leading to edema. So, this is how chronic liver disease causes edema. The third cause is renal dysfunction. Here, two things may happen. First, when there is increased filtration of the plasma proteins at the level of the glomerulus, so more amount of proteins will be lost in urine. So, when there is loss of albumin, automatically the oncotic pressure is again decreased in the blood vessels. That means the retention capacity is decreased. So, the fluid will leak out, leading to edema. So, this is seen in nephrotic syndrome. The second mechanism is that in chronic kidney disease, there is decreased excretion of salt as well as water because the kidneys are damaged. So there is excess retention of salt and water, thereby leading to edema. Next cause of generalized edema is nutrition. So whenever there is protein malnutrition, there is decreased albumin, again decreased oncotic pressure, thereby leading to edema. Excess salt intake. Whenever there is excess salt, the salt will retain water and again lead to edema. Next is refeeding edema. Whenever there is excess intake of diet, on one hand, this diet may contain more amount of sodium that will retain more amount of water, causing edema. And on the other hand, increased diet will increase the release of insulin, and insulin can directly increase the tubular reabsorption of sodium. So once sodium is reabsorbed, water is also reabsorbed, leading to edema. Next cause of generalized edema, and very important to look for, is drugs. There are three mechanisms by which drugs can cause edema. First is by causing vasoconstriction of the afferent arteriole. Now, if there is vasoconstriction of afferent arteriole, the blood flow to the nephron is decreased. So the GFR is also decreased. Thereby urine output is also decreased. That means the loss of fluid is decreased. That means there is more retention of fluid, leading to edema. So drugs acting by this mechanism include the non-steroidal anti-inflammatory drugs, NSAID group and cyclosporine. The second mechanism by which drugs can cause edema is by increasing the tubular reabsorption of sodium. So when the sodium reabsorption is increased, water reabsorption is also increased, thereby it leads to edema. So these drugs include the steroid hormones, which include glucocorticoids, anabolic steroids, or estrogen or progestin containing drugs like oral contraceptives, and thiazolidinediones, which are anti-diabetic drugs, which include pioglitazone and rosiglitazone, and just now which we discussed is insulin. So these drugs cause edema by increasing the tubular reabsorption of sodium. Next, the third mechanism by which drugs cause edema is causing vasodilation at the arteriolar end of the capillary. So this leads to increased vascular permeability. So this is a normal capillary, and this is the arteriolar end, and this is the venular end. When there is vasodilation at the arteriolar end, the permeability is increased. Thereby fluid leaks out, leading to edema. Drugs causing edema by this mechanism include direct arteriolar vasodilators like hydralazine, clonidine, methyl-dopa and minoxidil, and also the calcium channel blockers of the dihydropyridine group. Amlodipine, nifedipine, nicardipine and nimodipine. So all of them together are antihypertensives. Yes. So these are the mechanisms by which drugs cause edema. So drugs causing edema include NSAID, cyclosporine, steroid group, thiazolidinediones, insulin and antihypertensives, which again include the calcium channel blockers and vasodilators. So now whenever there is edema, see if it is localized or if it is generalized. So if it is localized, only think about three causes: venous obstructions, which include thrombophlebitis, deep vein thrombosis, valve failure, or lymphatic obstruction, which may be because of filariasis or unilateral paralysis. If it is generalized edema, then see the albumin content. The albumin content may be low, that is hypoalbuminemia may be present, or it may be normal. So if hypoalbuminemia is present, that may be because of decreased production. That means liver disease or increased loss like kidney disease, or decreased intake of protein like in protein malnutrition. Now, how to differentiate liver cause from renal cause of edema? If it is liver cause, then first it starts with ascites. In renal cause, first there is soft tissue swelling. So, first edema is seen in the eyelids and in the face. And also in liver cause, LFTs will be abnormal, and in renal cause, RFTs will be abnormal. So, these features can differentiate liver or renal cause of edema. Now, if the albumin content is normal, then think about drugs. So, drugs, especially the NSAID, cyclosporine, the steroid group, insulin, thiazolidine and antihypertensives. Or look for heart failure. So, heart failure, again, there will be dependent edema and the ejection fraction should be low. So, this is the flowchart showing approach to edema. This is the complete picture of what we have discussed so far. So that's all for today. Thanks for watching. Hope you liked it. Let's meet again with another new video. Till then, just take care, be happy, and stay safe.